Welcome to Marnie Reed Presents Connect to Develop, where we provide insight from healthcare leaders on the hottest topics and trends.
Hello, listeners. I am really excited about today's guest and topic. Please meet Dr. Camilo Molina, who is the Director of Spinal Deformity and Spinal Oncology, Co-Director of Patient Safety and Quality Improvement, Co-Director of the Complex Spine Fellowship, and Deputy Director of the Spine Innovation at the Center for Innovation in Neuroscience and Technology at Washington University in St. Louis. Hello, Cam.
Hi, Marnie. How are you? Thank you so much for having me here today. I'm really excited to be sharing some of my experiences and outlooks with you.
Well, I'm very excited, especially I have personally witnessed your very high levels of EQ in multiple settings. So this is quite a treat for me and for the listeners. In the corporate world, we're very aware of this term EQ, so emotional quotient, or more aptly called emotional intelligence. If you've ever had the pleasure of being coached by a mentor or been a recipient of a 360 review, then EQ has most likely come up in some manner. I'm a big fan of taking business person speak and translating it into surgeon speak. So, Camilo, when you talk about EQ with your residents, fellows, or even peers that you may be coaching or indirectly mentoring, tell us how you describe EQ to them and why it's so important, especially for surgeons to be aware of and develop.
I think the best way that I would describe that, when I hear your question, it brings me back to something that my program director in my neurosurgery training program said to me, Dr. Judy Huang at Johns Hopkins. She said, people rarely remember what you say, but they always remember how you made them feel. And this was a very impactful thing she said to me, because we as individuals in any type of stressful environment, we may have the ability to exhibit exceptionally high, quote unquote, emotional quotients or EQ in low to moderate stress situations, but in very high stress situations, or where we were pushed beyond our limits, where we conventionally had great EQ in a social setting, our EQ may be tested beyond the limits, and we may behave in ways that when we look back on, we regret. And so I remember having some of these interactions with her where she would circle back and say, look, so-and-so was not very happy with the interaction you guys had. And I was like, well, I didn't say, really anything. And I remember how impactful it was. She said, well, it's not what you said, it's how you made them feel. And so when I talk to people now and discuss this with trainees or colleagues, et cetera, I think about that. And your body language, how you deliver what you say, the tone of your voice, everything really impacts how a person feels when they walk away from that interaction with you.
That is a perfect summarization. And honestly, I wish I had your mentor back, because quite frankly, when I was, a young kind of off the cuff device rep and I was, getting coached and such, I truly didn't really understand that part of it, right? I was focused more on the data points, what I said, what my intention was. And so that how you made them feel, because perception is reality. So how do you maintain your cool? What are you doing to self-regulate?
Truth be told, it's been a deliberate self-development process. In the operating room, I always felt that I had great EQ, but the reality is that the person who was setting the tone was the attending. It was an experienced, technically gifted, some of the best people in their field at Johns Hopkins, and they were able to run these operating rooms, very smoothly. They were set everybody in comfort, and it was these usually great experiences that everybody knew each other's names and such. And that I always walked away feeling, for the most part, that I had this great demeanor in the operating room. But then as I progressed in residency, if you had a little bit more autonomy and somebody wasn't there to hold your hand or to set this tone, you realize that if you could get stressed out, and then what you thought was this great demeanor could easily derail into you being short or perceived as not necessarily rude, but not as friendly, stressed, different tone of voice, etc. Or similarly, if you're on call and you haven't slept very much, all of a sudden these kind of social personality mechanisms that we have to deliver our messages and intentions in a very pleasant and easy to digest way, a lot of those things you don't realize you're unable to do when you are at your maximal stress points. And you, as you progress in your training, not just in your clinical skills and technical skills, you also progress in your ability to recognize these things and mitigate them, and know that you haven't slept very much and you're irritable and you're what we call frontal, meaning that you're less inhibited. And if once you become aware that you're at risk of not being your best self, you work extra hard to think twice about everything that you are experiencing and feeling and about to say. And you really mull that over and say, is this the best way that I can respond to this situation right now? How will this be perceived by this other person? And you just have to be a little bit more thoughtful, reflective, and deliberate in what message you are delivering, not just with your words, but with your tone and your body language. And so I bring that even forward as a new attending. Now there's nobody at all to hold your hand, nobody to really fall back on. And what you thought you were so good at, all of a sudden, at least for me, was a big learning curve. Once again, taking on some very challenging cases in some very stressful situations. I was initially disappointed in myself into situations where I felt like I could have maybe not been so crass or so direct or so expressive of my disappointment at whatever situation was occurring. And I can tell you that I've very explicitly worked on this on myself and found coping mechanisms where if I recognize that this is a stressful situation or a stressful event, I just pause internally, take a deep breath, know that whatever is occurring, some things are inside or outside of my control, and find the best path forward. And rather than alienate the other team members, how do I re-engage those team members to help me find the solution to whatever challenge we're facing?
I love that. And how are you also coaching your team members and staff when they come to you and share that a peer or an experience they had wasn't handled? Kind of reverse EQ, right? Where they aren't the attending in the room, they don't get to set the tone, but they still have a part in the, theater, as they'd say in Europe, right?
I try to empathize and I'll tell them usually those comments come from staff members working with younger, newer attendings. Rarely is it seasoned attendings. Those attendings usually are very skilled in running a smooth room. And it usually comes as some type of negative interaction with a newer, younger attending who hasn't built up the trust in the team, and people don't know how they interact yet, and they don't know how to read their comments, and what may have been a very innocuous, innocent statement may have been perceived as something rather offensive, etc. So I tell them, I know exactly where you're coming from. I've been in those situations as a trainee and experience that type of kind of insecurity when somebody expresses towards you in a way that makes you feel very small. And I have also been the one to have reflected and found myself to be behaving in that way towards others. And I tell them that the reality is that it's an outward sign of that person being very stressed and relatively insecure as to the situation in front of them. And I tell them that I've experienced that myself in my growing pains from a trainee to an attending. And I ask them to be patient with that person and to let them know how they felt, and that most likely that person will be very impacted knowing that they made somebody else feel that way, and it will help them grow. I can tell you that when I started, this was a challenge for me, and trying to do challenging cases, but having scrub techs and be like, I don't know if I want to work with Dr. Molina. Sometimes he gets very stressed in these cases, and it's probably not going to be very fun and pleasant, and it's not the funnest work environment. Knowing that was happening, knowing how that was impacting the flow of the case as well as other people, I was sure to recognize that, and I made a lot of personal efforts to change that. And it has evolved to now I have a very, loyal and dedicated team of circulating nurses, scrub technologists, and scrub nurses who cover my cases consistently. And And that's entirely up to them on a voluntary basis. So I've seen firsthand the evolution of how just the way that you approach these challenging situations can have a tremendous impact on the team. And then you get past this inflection point that now everybody knows each other, everybody knows each other's behaviors and stress points on a mutual basis. And you can get past these challenges and have these tremendously pleasant, operative experiences, even in long days in the most challenging of situations.
I truly admire that you use yourself as a case study of what wasn't great and then the intentionality of working on it. So on the thread of, case studies show that one can actually develop and increase their IQ, so emotional intelligence quotient, until about the age of 20, and then it's pretty much set. I really wish someone had told me this at age 16. I probably would have tried harder. However, EQ, and in most instances, could and should be continuously worked on and developed. Data also goes to show that people with high EQ tend to have higher salaries. This isn't per se studied, I don't think, as much in surgeons, but definitely it has been in more of the corporate environment. And it has a huge impact on their careers, burnout, even, showing that people with higher EQ have less burnout. By and large, when you look at the leaders in your specialty, and you've talked with great admiration about your attendings at Johns Hopkins, and, you look at the traits that you admire about them, did you realize the EQ played a huge role? And if so, did you go to them when you found that you were struggling and ask them for resources, books? What did they advise on?
That's a great question. Beyond Dr. Huang pointing out some of these things to me, and that impactful statement that I brought up earlier about it's not what you say, but rather how you make people feel. I'm not sure that I ever deliberately went up to them and said, "Hey, was there something I can read?" or anything like that. But what I did make a mental note of, and very intentionally, as you put it, tried to do, was identify the people who I felt were able to handle themselves in the highest of etiquette, despite the most challenging and emotionally testing of situations. And I think about how they handled those situations. I reflected upon it, and I put it upon myself to try to act as they would in those situations. And here, since being at WashU, I've found attendings like that too, senior attendings do that just incredibly well. And I've tried to, observe how it is that they're able to do that, how in a public setting, in a faculty meeting, they respond to a very controversial or challenging comment, or deal with a challenging colleague or a challenging trainee, and the way that they very seamlessly and beautifully navigate those situations. And they can deliver the exact same message that I would have, but in such a way that it is perceived to be completely non-inflammatory, in a very compromising way, yet the overall, suggested solution is the same, but they do it so seamlessly, is something that I very routinely try to learn from and get better at. And I can tell you that it has yielded results.
I like that. And here's the hard thing, right? Is, watching. So it's like watching a very well-oiled team play, right? They know the plays, they know, each person's strengths and, where they're supposed to be, and they get an opportunity to practice. So this may sound a little bit funny, but seriously, in sales, they role play, right? They role play talking to different surgeons about your products and services and how to deal with a, tough nurse manager or a practice manager or a surgeon that, quite frankly, it's just kind of laying into you. Do you role play this? I mean, do you, in your mind, even just kind of role play what you would do? Do you reach out to your wife or your friends and say, hey, just say something really inflammatory and I just want to work on how I manage that? How do you practice this?
I have not role played it, but the reality is that it's trial by fire, inevitably, because of the nature of my job and what I have to deal with on an everyday basis, not just for my own patients, but interactions with other colleagues, and handling my personal family life with regard to the challenges that my occupation presents with balancing my personal life and my work life. You learn very quickly, if you're paying attention, and I hope most people are, I hope the listeners are, how to behave and avoid alienating people. because you quickly see some of the things you say that you thought were perfect, completely innocuous, were perhaps quite inflammatory and unproductive to solve a conflict. And so, at least for me, unfortunately, it has not been through role play or through some type of practiced or rehearsed response mechanisms. A lot of it has been trial by fire, realizing, boy, that was really not a good way to word that or to respond to that. Maybe I need to do this differently next time, because that was not the response I was expecting. That actually made the situation worse. That actually pushed the team away. That actually disbanded the camaraderie and the teamwork that we had going on. And now things are even more difficult. I need to do something different next time.
I want to go back to something that you said. You clearly have created a safe enough space where some of the support team, some of the non-MD team can come up to you and share a situation and how it made them feel. For the listeners out there who want to actively practice this, maybe they don't want to go around and just start asking people, hey, how did I make you feel? What are the ways that they could start intentionally creating that safe space so that their support staff, their peers, their colleagues, could give them feedback? Because let's be honest, I think everyone out there has tried to give someone feedback to help them improve and gotten just blasted. But how do you create that safe space so if you are displaying high EQ, and then if so, how and when to work on it?
Well, first and foremost, not just because this is the quality of being a good human being, but because it's something that's completely forbidden in the modern workplace, is that you cannot be under any circumstance retaliatory to people. Even if what their feedback that they're giving you is inflammatory about others that you care about or yourself, there can be no retaliation. There can be no, subversive, deliberate way that you're going to undercut that person, and they know it because of them bringing up a fair concern about your behavior and the way they made you feel. That in itself, I think, is a red line that should never be crossed. And if that is very clear and people know that there will be no retaliation, beyond that, it's just finding a way to letting people know that they can come and tell you something openly and transparently without you having some very uncomfortable emotional response. This is not easy. I can tell you that was not easy for me at first. And it's a work in progress. Perhaps there's some people who are naturally gifted at that, but I bet most of us fall within the normal distribution of the spectrum, that we're going to have to think outside ourselves when we hear something negative about ourselves or people or colleagues that we care about, and step outside and think about what that concern that person is bringing up to you and how that impacts them and how it makes them feel, and try to be as empathetic and objective as possible without being retaliatory in a formal or emotional way.
Compartmentalizing things has to come relatively easy. It's got to feel like a personal attack, I would think, when, maybe you do open up those floodgates to allow people, to give you feedback, and then suddenly maybe you're getting, more feedback. How do you step back and compartmentalize that this is not intended to be hurtful and to not take it personally, but truly look at it as a way to improve and fine tune, the soft skills?
I would say that there's something inherent about a surgeon's training, or even a clinician's training. They don't have to be a surgeon, medical doctor, or even a physician assistant, or anybody who works in these high stress environments. It requires many years of apprentice-like training. So a residency or medical school, you learn very quickly to accept and internalize negative feedback, because that's it. The way we learn in these fields, it's a more or less a Socratic method, and under different layers of supervision by multiple different supervisors of different levels of expertise. And so you have to have thick skin about yourself. So having gone through a neurosurgery residency in one of the best neurosurgery training programs in the world, nobody really walks in being some type of naturally gifted neurosurgeon. We're all novices and we learn everything from scratch. And there's a lot of things that you do wrong from the beginning that people are going to correct you and criticize you until you get it right. from the patient's management outside of the operating room to inside the operating room. And then eventually that's going to evolve also into your behavior. And so, at least me personally, but I would venture to say most of my colleagues, we've learned to accept, internalize, reflect upon, and adapt in a positive way to the negative criticisms we receive about ourselves. I think where you will find a lot of the challenges that test a surgeon's or clinician's EQ is when we feel as though there is a situation or an obstacle coming between us and our ability to provide clinical care, optimal clinical care for our patients. That is something that is just very conventionally triggering the way we're trained, the way we're so protective of our patients and how bullish we are about. That is the one thing that I find frequently results in somebody behaving in a way that is probably not representative of themselves. And I can say that for myself and observing others. That's the line in the sand that often triggers the uncomfortable behaviors in surgeons and or other clinicians. It's where there's this perception that whatever's occurring is now going to impact the patient. And we're so protective and bullish of providing the best possible care we can to our patients that's what will trigger these conflicts.
I think looking at it that way, so for all of the people that interface with surgeons, especially in surgery, when they do see, a surgeon, tend to flip out or lose it or whatnot, or act in a way that's not demonstrating, remembering that is a very extraordinary way to think about it. I remember as a device rep, I'd see, and to your point, it was usually the early career surgeons that, a drape wasn't done well or something wasn't set up right, and they would just lose their mind. And it, kind of felt like, where did that come from, and hearing it from you that way really puts a lot of empathy on our side to just, what could I in this moment do now to, help remove that barrier. For people out there that maybe aren't as self-reflective as you, maybe they like, structure, or they need a process. Is there anything out there that you've read or come about or whatnot that you would suggest for them to do? Books, online courses, just anything that you could suggest if people need more of a blueprint, right?
Yes and no. So at some point when I was thinking about this, I came across the concept, it's a Greek philosophy concept of stoicism, of maintaining calm and composure and behaving in a stoic manner, not allowing yourself to oscillate between large swings of positivity and negativity in the face of stress and challenges, but maintaining a calm, even keel despite the stormiest of turbulence. And, I've sought out different short reads on it, interpretations of it, examples of it. And it's something that I think about whenever I'm being emotionally tested. I think about, how do I maintain the most stoic version of myself right now? Because calling out that person for inappropriately draping the field, or being really upset that this was not correctly assembled, or that, it's not going to be productive. People, it's not like they're going to perform all of a sudden better because you made them feel very small about it. It's, how do I get past this situation while still maintaining this person and these team members on the common mission, which is to provide the best care for this patient? And the answer is never going to be by making them feel small and alienating them. And that's just not the best, the most productive way of getting the wheels back on the bus. And deliberately remembering that, despite how reactive and emotional you want to react to the way something or somebody did something, is the best foot forward, I believe.
That makes sense. And I've definitely heard about stoicism before. Any other tips and pearls that you'd like to leave the listeners with prior to us departing?
I would say that people follow people. So identify people that you wish you could be more like for whatever thing that you're chasing in your life's dreams is. For me, it's, obviously being the best version of a surgeon that I can be in and out of the operating room, and providing the best possible care to my deformity and tumor patients, and and really all my spine patients that I possibly can, as well as to educating what I believe will be the future of our field. In finding the people who do that well for me has been a goal, and I've found a lot. And trying to understand them, try to identify what it is that they do exceptionally well, how they overcome the challenges that they face on an everyday basis, and asking them for advice. And when you do that, and when you do that humbly, and you recognize that you don't have all the answers, you can learn so much from other people who've already overcome the challenges that you face. And when they equally recognize that humility in you, it will allow you to advance in whatever environment you are a lot faster.
Well, Cam, it has been wonderful. For those of you who would like to learn more about Dr. Camilo Molina and how to connect with him, please check out his bio in the show notes.
Thank you, Marnie. I really appreciate you letting me speak about this subject, because it's certainly something that has been a work in progress for me, and I hope to continue to evolve positively in it. And if I have any other additional thoughts in the future about this, I'll be sure to share them with you as I continue my journey as a surgeon.
Thanks for listening to Connect to Develop. You can find more interviews and Marnie's Minutes on my YouTube channel at Marnie Reed Presents.